Hi, my name is Kiru, and today we're going to talk about antisocial personality disorder. First, I'll go through an overview, then I will discuss risk factors, then we'll discuss symptoms, and then we'll go over treatment and management. So, antisocial personality disorder, what is it? It's also known as sociopathy. It's considered a mental health condition. It's usually diagnosed in individuals who display a lack of regard for right or wrong and ignore the feelings of other people. It's considered a lifelong condition. Symptoms like criminal behavior may decrease over time, but it's not clear if this is due to age or some other factor, such as becoming aware of hurting other people's feelings or the right or wrong, committing right or wrong. It is a personality disorder. People who people who have antisocial personality disorder do engage in spousal support, have a tendency to engage in child abuse, and could die early from an unusually violent death. So, what are the causes and risk factors of antisocial personality disorder? So, the causes include genes, childhood and life of abuse and neglect. It's sometimes caused as a result of changes in the way that brain functions as a result of a unique brain development, and this is obviously client specific. Often, people with a diagnosis of childhood conduct disorder also go on to have antisocial personality disorder as adults. If there's a family history of antisocial personality disorder or other mental health issues, then you are more likely to be at risk for antisocial personality disorder. If you grew up in an extremely violent family life or upbringing, you had an extremely violent upbringing, then you are more susceptible to antisocial personality disorder. Studies show that men are more susceptible to antisocial personality disorder than women. So, some other symptoms include people with antisocial personality disorder. They tend to make people around them angry or upset purposely. They're often manipulative. They treat people around them harshly and often display cruelty towards others. They lack remorse and rarely regret their behavior. They often violate the law. They're often criminally convicted for crimes they commit, often engage in pathological lying. They become violent easily. They act impulsively. They have substance abuse issues, so they abuse alcohol or drugs. They have difficulty consistently meeting obligations and responsibilities to family, at work, and while at school. There's a history of suicidality, and there's often symptoms of depression and anxiety and other mental health issues. So, how could you treat or manage antisocial personality disorder? Okay, so it's considered very challenging to treat and it requires long term support. Treatment must be client centered, and the individual with the disorder must be willing to change and take part in treatment. For those with offending behaviors and those who are in community or in institutional care, CBT or cognitive behavioral therapy in a group setting is highly recommended. There's also other behavioral interventions or democratic therapeutic communities that are highly recommended for people with antisocial personality disorder. There's also a recommendation for reasoning and rehabilitation programs that focus on reducing offending and antisocial behavior for people with this personality disorder. And there's also an emphasis on treatment of comorbid factors such as depression, anxiety, drug and alcohol misuse. Talk therapy and psychotherapy is also effective, and this is helpful in combination with medication. So, carbamazine and lithium help manage symptoms such as aggression and impulsive behavior. So, in terms of democratic therapeutic communities, evidence based practice suggests that community based programs are very effective in the long term for helping people with antisocial personality disorder. And this has become like democratic therapeutic communities are very popular in prisons. So it's a type of social therapy that aims to address the person's risk of offending as well as their emotional and psychological needs. And it's often done in small or large groups, and it focuses on community issues, and it creates an environment where like staff and in the example before previously in prisons, it could contribute to better prison populations, and also it could reduce recidivism when prisoners are released into the community. These programs also offer vocational work and educational opportunities. When doctors and psychiatrists recommend that if a patient is engaging in democratic therapeutic communities, that it's done for 18 months, and it should or more, and it should usually entail enough time so the person can make changes and learn new skills. It's really important that the person who engages in democratic therapeutic communities is self-motivated to do so. They have to accept that they do have the illness and they want to change. So part of the benefit of democratic therapeutic communities is that it allows people to work in the community and participate in groups and like learn democratic processes in places like prisons that they can take into the community. And this has been very effective for people with antisocial personalities, because a lot of people who do have the personality disorder often end up in prisons. So a lot of therapists, doctors, and psychiatrists have done this important work in prisons and saw a high success rate, and it's considered helpful for also people with antisocial personality disorders who aren't incarcerated and need community-based support in the community. I hope this presentation was informative. Thank you so much for listening.